ISHR hair transplant training workshops are now being conducted at Qatar.
Hello doctors, this video is for qualified doctors, that's plastic surgeons, dermatologists and facial surgeons who are interested in setting up the hair transplant center or starting the hair transplant practice. I'm Dr. Vivek, Organizing Secretary, Hair Transplant Workshops at ISHR, Indian Society of Hair Restoration. ISHR global headquarters are at Mumbai, India. ISHR also have chapters in few cities in India and abroad, having respective president secretaries who handle practical training in their respective cities and centers. We are inviting experienced hair transplant surgeons across India and the world to associate with us to offer to qualified doctors hair transplant practical training at their respective centers. So let's discuss in brief about ISHR workshop, curriculum and topics which we are going to cover for you. First and foremost, we're going to start with consulting a hair transplant patient, finding out what are the indications and contraindications for hair transplant. Then we are going to discuss how to find out how many hair grafts he has, how many hair grafts does he require, is he androgenetic alopecia or non-androgenetic alopecia. Then we are going to discuss about hairline design as per his age, height, ethnicity. He's Afro, he's Caucasian, he's Asian, he's Indian. So we're going to draw his hairline. We are going to discuss about distribution of the grafts. Is he going to comb from left to right or behind? So when he comes for a consultation, we have to show him how he's going to look, how many grafts we are planning to put, how many grafts he has got, how do we distribute these grafts, etc. Of course, we're going to ask a lot of questions which he'll ask, the frequently asked questions from the patient, like how long the hair transplant result may last, is there any complication, side effect, what is our technique, and so on. Is it going to pain, and so on and so on. Will the hair really come? What is the success rate, etc. Then we are going to discuss about art of hair extraction. What is safe donor area? What is a good donor management? What sort of instruments can be used, like the hybrid punch, the trumpet punch, the sharp punch, the dull punch, the role of tumescence for the donor area, okay, the role of skin retractor for the donor area, the role of Z's magnification loop for extraction, and so on. Like we're going to leave 3 or 4 grafts and take 1 graft. It's called proper donor management, so there should not be any donor depletion. Then we're going to discuss about different methods of hair implantation. We're going to make a slit with sapphire blade and we're going to implant with the forceps, one method. Or we're going to make the slit with a sapphire blade and implant with a keep implanter, the second method. Or we may not make any slit and directly implant with the direct pen method. Then we're going to discuss about angle, like 15-20 degree angle at the hairline of the frontal scalp, 30 degree angle at the mid scalp, 40-45 degree, and a swirl pattern at the crown area, 5 degree at the temples, 10 to 15 degree at the frontotemporal angle. So we have discussed about the depth of hair transplant, the techniques of hair transplant, the distribution of graft to create illusion, and the angles and the direction and the curls of the hair follicle. So these will be covered. We are going to discuss about pre-operative preparation, what investigations we have to do, post-op care, medical emergencies, surgical complications, and so on. In the hair transplant instruments, we also discuss about different machines for extracting of hair. Different micromotor machine, the 360 degree rotation machine, the 180 degree oscillation machine, the manual extraction method, and so on. Because for Afro hair, machine would be different, the punches may be different. For long hair transplant, the punches may be different. So there would be different equipments for different ethnicity, which we are going to discuss once you come for the hair transplant workshop. We are also going to discuss how to reduce post-FUE macro scarring or white dots. We use biotech products to reduce it. Okay. During analysis, remember, we're going to check hypertrophic scar, keloid, is he having any cardiac issue, respiratory issue, epilepsy, autoimmune disorder, LPs, psoriasis, alopecia areata. So, you have to thoroughly evaluate him medically as well as scalp so that you don't take on cases which were not indicated. That's very, very important. Another important factors which we have to discuss is how to extract quality grafts. The graft should not be transacted. Okay, if you need soft hair from nape of the neck for a feathery hairline around 150, you should store it separately. Then you will need around 2-3 hair follicle which are single for the transition zone, so that should be stored separately. After that, you should be cherry picking and taking out thicker grafts like 2, 3, 4 follicle. And the most important is don't damage them, don't let them dry. Don't avoid transaction. So initially you will have little transaction, but as you become a senior surgeon, your transaction rate should not be more than 3%. So there will be a whole discussion about the science of hair graft extraction and how to prevent transaction for better hair transplant results. We will also discuss comparison between FUE, the new techniques where you take out single graft, follicular unit excision, as well as FUT, where you take a strip. Where this should be used FUT, where FU should be used, where there should be combination of the two. What are the advantages, disadvantages of the FUT, the strip method, and what are the advantages and different advantages of the FU method. We're going to discuss about terminology in hair transplantation, and of course, there is sometimes confusions of different types of FUE. So we'll dissect it, the principles behind naming of a particular technique of FUE. Then the two most important thing, exclusive with very few clinics, that is a new technique called instant FUE we want to discuss. See, as you see, most of the time the hair grafts were taken out and they would be keeping hair graft for 5 to 6 hours outside. Now they may die or the survival may be reduced, maybe I'm saying, because if you cut the finger, immediately within an hour you have to suture it back or it's gone. If a fish comes out of the water, it has to be put back. So the temperature on the scalp is 37.2 degrees centigrade. And the temperature outside, with most of the people are putting in a chilled container. So this difference of temperature certainly can damage the grafts. So what with this new technique IFUE, which you will be learning, is take out the grafts and implant simultaneously. Maybe 1000, 500, 250, 100, whatever technique you want to do, but reduce the out of body time of the grafts. So that, see, the moment the graft is cut, its blood supply is gone. Where is it going to get oxygen from? The sodium potassium channels will go haywire. Free radicals will start developing. Okay, so it's about to die. So we may keep in the best of ATP thermosols or a DMA medium, etc., great, or a plasma light we have to keep. But if we can transfer it back immediately to the same milieu, the same pH, that is the scalp, so through diffusion and imbibition, the oxygenation will happen, nutrition will happen, and the survival will be better. And with this technique, we have seen the grafts coming faster, and we have seen some better results the last 3 years since we are using this IFU technique. So the people may call this with different name, but it's pretty new technique, and we are quite sure in the future this will be the technique in the world. So instant FUE technique, simultaneous extraction and implantation of a graft. We have a special chair for it, and certain ergonomics have to change. The team has to be bigger. Another important and unique thing which we want to cover in the hair transplant workshop is special care post-transplantation of the hair grafts. That is, as you see, if you want to put 4,000 plants in your garden, not all are going to grow. Similarly, if you're going to put 4,000 grafts, maybe not all are going to grow. So when they are developing their own blood supply in the initial few days, we want to put PRF, GFC, special culture media, ATP thermosol, bombarding with antioxidants, and so on. So this protocol is being developed so that the hair grafts survive better, especially the first 3-4 days where a few grafts may die as they have not yet developed the full blood supply in the capillaries at the double papilla. So this is a unique thing which we're going to discuss: post hair transplant hair graft care for a better hair survival. Depending on which program you have joined, we will discuss about beard hair transplant, eyebrow hair transplant, body to scalp hair transplant. Okay, so as you know, these are different textures and anagen-telogen ratios are different in different location. So we're going to discuss about eyebrow, burn scar, body hair transplant, beard hair transplant in the advanced program of fellowship. Those who have joined for the advanced program for fellowship, we'll be covering these topics too. So there's something called branding. Positioning, what do you stand for? Like people love if you're doing only hair transplant, so you're a specialist in that field. What is that unique technique you're doing? So, and also remember the importance of hair transplant technician in your team. You alone cannot do the surgery. Okay, so you should have an experienced team and same team for the long term, both technical as well as very good team in your clinic staff who is going to take the first phone call. Remember, patient going to see your website, then going to call to your receptionist, and then come to you. So before there's a lot of happening, so make sure everything is in place. Use hair transplant software so everything is systematic. After 5 years also, you can SMS, WhatsApp, or call your patient to know the status. So follow up is so important for your patients, because the same patient is going to give you more patients. So we want to discuss about branding, positioning, communication, hiring of the right staff, hiring of the technician, where to get them, what are the legalities, what are the taxations. So ISHR is all about 360-degree solution, because we have seen a lot of doctors who are doing well, but they stop here. So we hold their hand, try our best to set up the practice, help them become more successful, but alone we cannot do, as a team we can do. So this is a very important aspect called the finishing touch. After you know everything, how do you come as a physician into the market, and how you become a successful hair transplant practitioner. For any further queries, please contact at the numbers below. Our counselor will guide you and help you and sort out most of your queries. So goodbye and see you.